Dr. Siri Berger here on Holohan's Hot Topics. I'm with Dr. Melissa Holohan. Hey, doctor, what's happening in the world of critical care this week?
Hi, well, this week we're going to be talking about a clinically relevant use of a portable prothrombin analyzer in dogs. I think this study is great because we're always looking for point of care testing and something that's not a huge expense to add on to even a general practice. So, the background portable point of care analyzers are certainly becoming more common in human medicine, especially for at home use. And that's mainly because they're doing at home monitoring of warfarin therapy. It's easy to use, there's low maintenance, and they get immediate results. And it's very similar to using a glucometer setting, so a very small volume of blood is needed. The CoaguCheck XS is a portable battery operated laser photometer, and so this is a testing analyzer that could be used in veterinary medicine and had not been evaluated or compared to other in-house coagulation testing. There was a previous study done last year that evaluated this analyzer compared to the lab test, but we really wanted to see in this research study, they wanted to evaluate it to the most common portable analyzers that you would be using in practice. And so what they did was you use a drop of whole blood placed on the testing sensor, and then the blood clot formation time is reported in seconds. And so you can see on these pictures pretty easily, again, just like a glucometer, using a drop of blood and finding a very rapid result. Although warfarin therapy in dogs is uncommon, anticoagulant rodenticide intoxication is not. And so this is something that is frequently diagnosed in our veterinary patients and is actually reported as the third most common intoxication in a report from 2010. So in-house coagulation testing is often unavailable in most private practices, mainly due to the expense of having that equipment in your hospital, and not only equipment, but refrigeration and upkeep of a lot of the sensors that are required for measurement. So the objective of this study was to look at and assess the performance of the portable prothrombin time analyzer, which again was named the CoaguCheck, in dogs particularly. And so they actually had 97 dogs that they evaluated, 20 of which were healthy controls. 45 dogs were ill, but with diseases that were unlikely to affect coagulation. And then they did another 32 dogs that were ill with altered coagulation. And certainly the majority of those were anticoagulant rodenticide intoxications. However, many other systemic diseases with coagulopathies were included in that group. For the procedure, they took whole blood samples collected and they measured the PT in two different forms. The prothrombin portable analyzer that they were evaluating, and then they compared that to an automated coagulation analyzer used in their hospital, and that was actually the ACT 200, so a common analyzer used in many large universities or private practice, especially hospitals. So the PT reference range for dogs with that particular analyzer was 6 to 8.5 seconds. So results of the study, the CoaguCheck XS had a reference interval evaluated prior to initiating the study on a reference group of the 20 healthy dogs. And so the reference range found for this study was 9.6 to 11.5 seconds. They found that it was very easy to use, again required a very small drop of whole blood, and the results were reported within a minute. The mean difference between the PT evaluation of the handheld method compared to the lab analyzer was 2.5 seconds. However, there was about 94% of the samples that fell within limits of agreement. So a pretty accurate assessment when we're comparing a point of care test. So when they looked at the results of the sensitivity and specificity, the study had a pretty high sensitivity, which essentially means that it's a very good screening test when looking at patients with a potential coagulopathy, which is really what we want to evaluate it for in veterinary medicine. The CoaguCheck XS did identify all 8 dogs that had anticoagulant rodenticide intoxication, which is important because that's going to be the most common use that a general practitioner would evaluate or use this machine. However, it did not evaluate accurate results in anemic patients. So I think you need to take this into consideration if we're using it on an anemic patient. And in some of these patients that are severely affected and bleeding from rat poison, that may be the case. So what the study researchers concluded was that the point of care analyzer was simple, user-friendly, it was highly precise, and did have moderate correlation. When the PT is normal, it is a reliable PT screening test, which is again really why we want to use this test in a general practice. However, when the PT was prolonged or abnormal, and or the patient was anemic, the authors confirmed that, or concluded that it should be confirmed with a standard method. So I think the main takeaway point from this study, when I looked this analyzer up on the web page, it's about a $900 analyzer, and I'm assuming from veterinary products you probably could get it for less expensive, and they come with little tiny test strips. So I think that adding this onto a general practice would be a very feasible option, because the only other method that you would have is to send that blood work out to a large laboratory like IDEXX or Antech. And of course, you're usually not going to get those results back same day. And those patients really need to have a rapid assessment and then sent to a referral hospital for plasma or transfusions if needed. And so I think this is a great screening tool. It would be a very easy analyzer to add on to a practice for evaluating in-house lab work. So that's it this week, Dr. Berger, on Holohan's Hot Topics.